ম্যাম আমি লাইভে আছি, তো আমি জাস্ট একটু পরেই হ্যান্ড রেজ করে স্টার্ট করে দেবে।
Sure. Good afternoon, everyone. This is Dr. Shivangi Das, Ayurveda-charya, Kolkata DS Research Center. Today we will be talking about taking the charge of your life after cancer diagnosis. And it is one of the most important topics. Reason behind that, once a person or a patient gets diagnosed, it shakes, it shakes from inside, not only the patient, the complete family. So, how we can take the charge of our life after being diagnosed with cancer becomes an important topic so that a person doesn't lose hope after being diagnosed and understand how he can or she can recover. The practical lessons are important. Understanding the disease is important. Understanding the disease, analyzing the diagnosis, the challenges that a person faces after being diagnosed, and how we can minimize the damage at physical, mental, and emotional level after being diagnosed. So today we have our two doctors, Dr. Kashika Singh from Varanasi and Dr. Priyanka Chakraborty from Guwahati. Welcome, Dr. Kashika. Welcome, Dr. Priyanka.
Thank you
So
so
as
much.
so as I was introducing that what we will be talking about, uh, I'll start with Dr. Priyanka today. So, Dr. Priyanka, you have been taking care of patients, you have been treating cancer patients. So, how do you tell me or the audience that how a minute focus on your body becomes a primary goal for cancer treatment after being diagnosed?
Okay. So, after diagnosing cancer, after being diagnosed a cancer, often patients starts panicking. So, what will be the outcome of mine? How will I manage it? So, everything in taking it together. So, first approach towards management of that disease of cancer should be totally based on how the patient focuses on his or her body. Okay, the physical focus towards his body um, makes a great change in the cancer treatment. Okay, so this physical focus comes in two ways, should come in two ways. The first focus should be on how the patient, how he or she is dealing with the complaints which he is having on daily basis. Okay, he should keep in mind that what are the complaints which he is having. It might be fatigue, it might be dizziness, it might be the very common symptom, which is pain. How the pain is going. Yes, this should be, he should keep in mind that how his symptoms are from the day of being diagnosed and on the days that goes by. Okay, and the next thing which he should keep in mind is the how he is coping with his disease, like how he is managing the disease with these signs, how is his lifestyle is. Okay, how he is managing his lifestyle, how is he managing his diet, and obviously by seeking professional care and by seeking help from the caregiver, immediate caregiver. By these two important focuses on his or her physical minute, this thing too together helps not only in boosting his or her own previous strength, previous being diagnosed cancer strength, and but also improving his quality of life, because the main focuses of cancer treatment, the first and prime focus should be the improving the quality of life, okay, which automatically boosts the physical and mental status. So yes, by coping with these two and managing these two, we can easily fight with the cancer.
That's very true, and that's lovely that you explained it so well. Yes, that's very true. Once a patient gets diagnosed with cancer, the first thing that comes to the mind is, oh, so it is a scary situation and it is something that is not manageable. But understanding the diagnosis, stage of disease, the type of the cancer, site of the cancer becomes important key to understand the disease. Once you understand the disease, yes, you will be able to cope. And this is what I wanted to ask Dr. Kashika. So, Dr. Kashika, please tell me how a patient should start feeling or must begin to feel that there are chances of getting control over this shocking diagnosis.
See, after a cancer diagnosis, emotions can feel overwhelming. And in Ayurveda, we guide patients to gently reconnect with themselves through breath, routine, and grounding practices. Calming the mind with meditation, balancing the doshas, and it helps them process fear and shock. And I believe as their emotional clarity returns, patient will begin to feel more anchored, and with that, a sense of inner control slowly grows in all of them.
Yeah, that's me. So, that's true. That's very true. That your mental strength is the base of the physical strength that will be needing to deal with this type of diagnosis. So, Dr. Priyanka, yes, mental health is something that gets affected. Whenever a person is facing any kind of disease and something like cancer, yes, mental health gets affected. So, how do that patient overcome it?
Cancer obviously, as you have said, cancer obviously affects mental health, because we have seen in our OPDs, patient usually comes, as I've said, patient usually comes in a panic state. So, doctor, what should I do? What coming years, I have my daughter's marriage, I have those important works should be done, I have to do it. Will my days are coming? How long will I live? These are some questions which a cancer patient randomly asks. Okay, so yes, they go through a big mental breakdown. I can say mental breakdown after hearing the knowledge of, after hearing the cancer, that he or she has cancer, and also through the process of being in the treatment of the cancer. So yes, the patient go through in a state of anxiety, depression, and sometimes also patient complains of anger issues also. So the anger issues which which the complaint generally comes from the caregiver, from the family. My father is very angry all time. How should we manage it? So we advise them. We tell the patient, we tell the attendant to contact with the we should contact with the patient. Okay? So to the patient, we tell them two things to overcome this everything. First, seek help. Seeking help is not a crime. You can seek help immediate your caregiver, which is might be your husband, might be your wife, might be your daughter, anyone which is directly in relation to you. Ask him, tell him what you are going through. You might be in pain. Because of pain, you might be having anxiety, you might be having anger issues. So share with your family members. And second, seek help from your any professional, any doctor or any psychological counselor. He or she might help you. The doctor or the counselor might help you with um, advising you how to cope with your anger issues, how to build mental stability. He might advise you meditation, some breathing exercises. And Ayurveda has in the books, in Ayurveda it has been mentioned that with if we want to have a good body, we should keep in mind our mental health. Our mental health is in number one position if we want to keep our body in a good position. So we tell the patient that thing. So you should keep your mind that you have to control the emotions which you are going through. Yes, you should. The more you will express your emotion, the more you will overcome your mental disparity which you are having right now, by seeking help from your doctor, by the psychological counselor which you are having, and express them what the problem you are going through. And obviously they will advise you the counseling which you need and the medication which you need, anything you based on the present situation. And yes, Ayurveda has mentioned that good meditation and proper exercise, physical exercise, will help in maintaining, coping the mental stress. So yes.
Yeah, that's true. That's really the case that a person, or most of the times we come across when we are treating a cancer patient. Yes, that's true. The moment the diagnosis comes to a patient, the first thing that person loses is hope. That leads to frustration, anxiety, excessive stress, that how I am going to deal with this. And because it puts a question mark on the lifespan of patient, that person or the patient has multiple things to get done in his or her life. So that is a stressful situation. And and end of the day, they start venting their emotions in form of a rage, in form of an anger, and working on those emotions becomes another tool to handle this disease. So thank you for explaining so well. I'll ask this similar question to Dr. Kashika as well. Dr. Kashika, tell me few of the practical steps that a patient can take up to address the situation.
The cancer care is not just about killing the cancer cell. So in Ayurveda, it's about healing the whole person with evidence-based medicine, lifestyle intervention, which are rooted in Ayurveda. They definitely offer as a powerful tool. So I will be telling a few steps for the patients that they can adapt. So the foremost important thing is the psychological resilience, which is the sattva in Ayurveda. So Ayurveda teaches us acceptance, meaning making, and personalized coping strategies. Now, this aligns with the modern psychological care, and it will help the patient to regain a sense of balance. Instead of panicking what has happened, what will happen to me, accepting the disease and moving forward it mindfully, right? Secondly, what the patient can do is they can definitely, on the very foremost first days, they can improve their diet. So the agni and the digestive strength is like becoming better. So Ayurveda will definitely emphasize on taking the fresh and seasonal foods, whole foods, which will align with the modern cancer nutrition also, along with the guidelines that modern cancer nutrition gives. Spices can be added like turmeric, garlic, ginger, and whatever is proven anti-cancerous under a supervision of any expert, Ayurvedic expert. They can also add yoga, meditation, which has a proven shown result to reduce anxiety and depression. It will also improve their fatigue and the quality, sleep quality. Also, this American College of Sports Medicine I read about, they endorse yoga as a safe and beneficial during the treatment. All right. So when the patient engage in these, or they, feel, they will feel less passive as recipient of the treatment and more like active participants in their healing journey. And this will empower them, and it will be more centered.
Thank you, Dr. Kashika. You have explained so well and you have given examples as well. This is going to help our audiences. And how does integrative approach through Ayurveda uh, works during and after cancer treatment?
So, as an integrative approach, where I will be taking and talking about Ayurveda, considered as mainstream alongside the conventional therapy, allopathy. And basically, we focus on restoring the balance and supporting body's natural healing process. It can be done during the therapies, and we prioritize the individual care, accessing the unique doshas, constitution, which is the prakriti, and current imbalances. Ayurvedic method, they will complement the conventional treatments by addressing their side effects, which generally happens in most of the patients, which are fatigue, nausea, immune suppression, myelosuppression, a lot of these things. All right. So herbal medicines, which is a very commonly used in our day-to-day practice, that we also give to our patients, ashwagandha, turmeric, tulsi, they strengthen the immunity and they will reduce the inflammation which is caused by the allopathic therapies. Diet is also personalized. So with that emphasis, we give the easily digestible medicines, digestible food, and anti-inflammatory foods. So mind-body practices can also be advised, which are yoga, pranayam, which will reduce the stress alongside the conventional therapies. And we promote healthy mental well-being also. So I believe this holistic approach, it will enhance the recovery, it will prevent the reoccurrence and optimize the body's resilience while working in synergy with medical protocols. Also, I suggest where it is required in conventional therapies to get surgery done, it can be done, right? If the patient is required to get a surgery done, it is always advised by us to get it done. We do not ask the patient to avoid surgery and only take Ayurveda as a conventional treatment where it cannot help completely. So integrative approach can be, used there. And also where the modern treatments, the conventional therapy do not work on the patients. The patients who are immunosuppressed, they cannot get the surgery done. Or sometimes I've also seen the tumors are very, deep seated. They are involved, with a lot of blood supplies. The surgeons cannot remove it. So there, the Ayurvedic therapies, the treatment, the anti-inflammatory drugs that we prescribe to the patient or prescribed by any of the qualified Ayurvedic doctor, they will reduce the inflammation, and later on, maybe it can be possible to remove out those tumors without causing any hamper.
That's great. That was a lovely information that you shared. So, according to Dr. Priyanka, can you summarize in 5 steps, quick tips? I would say that how to fight back cancer.
So I will say based on Ayurveda, what Ayurveda says to how to deal with the cancer, how to cope with the cancer symptoms in 5 easy steps based on our Ayurveda. So in Ayurveda, it has been mentioned about Traya Upastambha, 3 pillars. That is Ahar, Nidra, and Brahmacharya. So that these 3 out of 5, 3 comes from Ayurveda. 3 means you have to maintain first one Ahar. We have to have a good balanced diet. So one patient, when being diagnosed with the cancer, should start from the day of being diagnosis, should start a healthy diet, avoiding the sugary products, avoiding processed food, everything those which are harmful to him or his body. Second, Nidra. Second is the Nidra. So a person, a cancer patient who is being diagnosed with the cancer, should have a minimum 6 hours sleep. He might be having pain, he might be having severe pain. So based on that, they think pain, medicine would be given based on the to cope with the pain, but trying to have a minimum 6 hour sleep should be done by the patient, to have to not only give being a good mental well-being, but also it helps to suppress the increased stress hormone, which if it increases more, if the stress hormone increases more, obviously the mitotic division which is being going inside the body, which is causing the tumor to metastasize, will obviously, if the patient is doing a good sleep, is having a good sleep, a good night's sleep, obviously the stress hormone will gradually decrease, and it will also suppress the regression of the tumor, and to help in the suppression of the tumor. Okay, so next, the third point is obviously brahmacharya. Brahmacharya not only means celibacy, maintaining celibacy, but also having an active lifestyle, which I have said priorly. So active lifestyle means not having a proper body movement, because proper body movement is very necessary in day-to-day life. If a patient thinks, oh, I'm being diagnosed as cancer, I should take rest. Obviously, the person should take rest, because he will be in fatigue, he will be in sluggish, the body will be sluggy. Obviously, he should take rest, but in proper time, proper process should be there. Otherwise, if he is not having any complaint about fatigueness or anything, obviously the body should move, because as the body will move, the whole process, the metabolism which we are having inside the body will work properly. And fourth is seeking help. As I've said in the mental also, seeking help is very important. Seek help to your caregivers. If you are having pain, you shouldn't be like, oh, I'm having pain, I shouldn't tell them, they will be in sorrow or they will think much. No, they will in return provide you the help which you need in controlling the pain or controlling the dizziness which you are having during that time. Yes, fourth is very important, seeking help from your caregiver, and in that process, seeking help, the help from the family also comes with it. The help from the family should also support that patient which is being recently diagnosed as cancer. Okay, and the last and the most important is having a proper doctor follow-up. How the doctor is giving the treatment, having a good follow-up, when the doctor will address you, how are you feeling, and what are the complaints which you should discuss with the doctor which you are under. Okay, these are the 5 things which should be maintained, and in our center, in our DS center, we follow these 5 steps in our daily patients, OPD patients, and if any patient call us, we tell them to follow these 5 steps, because these 5s together can help in fighting the disease, can help in encouraging the patient that they can fight with the disease, they can in the recurrence stage, they can block the recurrence path. So yes, these 5 should be maintained by any cancer patient.
Yes, thank you, Dr. Priyanka. I won't say it was a very short summary. It was quite elaborate, and I think our patients and our audience will understand what are the important steps to follow. I will go to Dr. Kashika. Dr. Kashika, how to address the emotional turmoil a patient and the caregivers are going through when the patient is diagnosed with cancer? Initially,
Yeah.
what happens and what happens later on?
Sure. So after a cancer diagnosis, it's completely normal to feel a flood of emotions. A lot of people, they are in tension, fear, anger, sadness, anxiety, a lot of emotion, even numbness. Sometimes I've seen that they cannot process the situation, they're not ready to accept it. So these emotions may come in waves, I believe, and they feel overwhelming, and like there's no right way to feel it. Of course, we are all humans. So accepting what has happened and emotional turbulence is a part of cancer journey, I believe. And you need not to control your emotions. You need to feel it. You need to care for them, right? Through breath, routine, and gentle support. And allowing yourself to feel what you feel. And if you start allowing yourself to feel what you're feeling, you'll find calm in the chaos and in the storm, and you'll sail through it. You can even join the support groups. See, there are a lot of support groups also there present, so you can join them also. You can talk to your family members. You can seek support. As Dr. Priyanka said, it's very important to seek support from your family as well as your doctor. Whoever is treating you, you should be in touch with them. You should have a good counseling session with them, which can give you a good motivation, a sense of control to your disease, because mind, your willpower plays a very big role in cancer treatment. Once you lose it, you're already lost the battle. So if you are staying strong with your mind, you're definitely going to sail this boat. And after even the you are cancer free, you need to be very emotionally strong, and you have to motivate other people who are into the journey. If you are the survivor, and for the people who are into it, you should always take inspiration from the people who have battled cancer more than once. So they are live inspiration. You should talk to them, join their support groups, talk to the doctors, so that you can have a good control and calmness over your mind.
It gives a clear picture what a patient or the caregiver can do to overcome this situation. In today's session, what I understand, I think all the viewers or the patients who are listening to us, they also understand that being diagnosed with cancer is not something that is a death warrant. I guess. It isn't so. It is a disease that can be taken care of, and there are chances of recovery. Yes. How and what you can do is first understanding the disease, understanding what are the challenges that might come up, that keeps you prepared to face them, understanding how to deal this disease physically, mentally, emotionally, in every way. Our doctors today has explained what you can do, and this is a very fine example, and a fine example of understanding, giving it an ear, analyzing the situation, dealing with it, and coming out of it as a survivor. Thank you so much, Dr. Kashika and Dr. Priyanka, for joining us and giving us lovely information about how to deal with cancer, how to take charge of your life after being diagnosed with cancer. Thank you so much.
Thank you so much.
Thank you.